Hi everyone, welcome to my channel. This is me Suparna back again. So we are going to be doing a series of skincare videos called the Skin SOS. Now I have an oily skin, therefore I really don't have much knowledge about dry skin. So this is a department where I needed help. To my delight, there was Dr. Jyoti of Skin Nature Clinic who very willingly stepped up to help me make this video on dry skin care. Dr. Jyoti is a celebrated cosmetologist from Jaipur. She has a clinic called Skin Nature. She also has a YouTube video. Do check out her YouTube channel because she has profound knowledge of skincare and is the person who has helped me through my bad skin phase. It was her recommendations. Before I met Dr. Jyoti, I had no clue as to what retinol was, how effective vitamin C was. So without further ado, let us begin this topic. If you have dry skin, this is the video you have to be watching. Her immense knowledge on dry skin care or skin care in general is just astounding. So now I'm going to be quiet and leave you with Dr. Jyoti.
Hey Suparna, thank you so much for calling me for this video collaboration. Hi friends, I'm Dr. Jyoti and I shall be taking up the topic of how to care about dry skin condition. So before talking about what is the basic nature of a dry skin, I shall explain you briefly about the basic nature or basic structure of a skin. A skin is, to understand grossly, is made up of just proteins, lipids, or we can say fats and water, built up in a similar way just as a wall of brick and mortar. Here all these three ingredients, proteins, fats and water, plays a very crucial and very important role to help skin perform its important functions, which are barrier protection, temperature regulation, and to serve as the first line of defense. Now to say that in dry skin, what is it that is exactly lacking? This can't be said precisely. It can be lesser amount of epidermal water or water present in the first layer of your skin, or it can also be lesser amount of natural oils or fats present in your skin. So a deficient amount of fats or proteins in your skin will let the skin water or skin moisture evaporate very quickly, no matter how much amount of water you drink your whole day. This condition, apart from internal structure or internal buildup, can also be triggered by external stimulus like extreme hot or extreme cold weather conditions, long time exposure to sun, or long sitting in air conditioned rooms. Also it can be because of few drugs, and it can be because of frequently washing your face. This dry skin represents to be rough, scaly, and flaking is visible over the skin surface. It sometimes becomes itchy no matter how much amount of oil or creams you apply. To make out that if you are having a dry skin condition or not, I can suggest you or I can ask you that after washing your face with a face wash, with a normal face wash, if you do not apply anything for next 5 to 7 minutes, if you find that your face or your facial skin is very stretchy and it's itching and you feel dryness, then you are having a dry skin condition. Also, if you find that only some areas of your face is dry, around mouth, around nose, or cheek areas, but you feel very normal after washing your face in your forehead region, in your nose region, in your temple regions, then you might be having a normal to dry skin. Also, if you find this T-zone area to be oily and rest or lower third of your face to be dry, then you might be having oily to dry skin. So if we discuss about what are the normal challenges such individuals face in their daily routine, the first thing is that such type of skin, dry skin, becomes flaky and itchy at parts, which is at first place is very unpleasing and unesthetic. Such skin condition is more prone to have rashes or breakdown, as these skin types are very sensitive also, so they have to be very precise and picky when choosing their skincare products. These people just can't use any OTC products or any regular makeup. They have to be like very selective for them. Also, regular salon treatments might not suit them, and a few professional in-clinic treatments also might not suit their skin type. This condition is prone to show the signs of aging very early in age as compared to the other skin types of their similar age. So it becomes a challenge for them to maintain the healthy skin type. So their dry skin condition will grow worsen as they grow old in age. So they need to be extra cautious and very careful about their skincare routine. A proper skincare routine for them will include first cleansing with a cream based cleanser or the cleanser which are meant for the sensitive skin individuals, followed by a toner which must not include any other additive like a vitamin C or glycolic acid, because they may sensitize the skin, followed by a good moisturizer to replenish the lost hydration during the cleansing process. After that, there has to be sun protection applied on the face to protect the skin from the harsh sun rays. In night routine, there will again cleansing of the face in the similar way as it is done in the morning, followed by a good serum which must include hyaluronic acid. If hyaluronic acid is not a constituent in any other cream of their routines, because hyaluronic acid is a very good and natural moisturizing agent which is hygroscopic in nature, which means it absorbs water from the surroundings as well to maintain a good hydration level in the skin. If not using for a hyaluronic acid serum, they may opt for facial oils also. This serum will be followed by a good occlusive moisturizing agent. See, moisturizing agents in morning and night as well, both time must include at least 2 type of moisturizing agents. Also, I must mention that if you have entered your 30s, then both the routines must have the last step of applying a good under eye cream. This is about their daily skincare routines. When talking about weekly routines, it must include a gentle exfoliation process. It should not be harsh, followed by serums, and after that a good face sheet mask, and not face packs, as face packs will further dry out their skin. Talking about diet, it is very important at the first place to include fatty acids and water in their diet. Water, I have mentioned that they are supposed to drink at least 5 to 6 liters of water. And when talking about fatty acids, omega-3 fatty acid is very important for them to have, which can be found in eggs, fishes and walnuts. Ceramides are very important for them. Ceramides can be found in rice, wheat and corn. If they have no other health issues with them or running in family, they can have good amount of cholesterol also in their diet. This will help in balancing their skin condition. When checking the do's and don'ts list for the skin, it is very precise and to the point. When talking about what they are supposed to do, it is that they should opt for a good moisturizing cream and be consistent in applying them, be regular. It may be applied multiple times of the day. And then they must drink ample amount of water in a day, at least 4 to 5 liters. Now, mentioning that what they are not supposed to do, it is like they are not supposed to wash their face frequently in a day, maximum 2 times it should be. Later that they should not apply AHAs and BHAs to their skin. They should not apply vitamin A or retinols, especially plain formulations to their skin. It can be included in like night repair creams. They must not use soaps on their face especially, and also body surfaces. It should be replaced by liquid body washes. They should not choose any OTC skin products or makeup products. They should be very selective, and better if it is on prescription. And when makeup is applied, first layer that is applied on your skin must be a thin layer of moisturizer, in order to protect itself from any harmful ingredient present in the makeup, which is unavoidable. Now, to conclude everything in a nutshell, with each passing year their condition is supposed to get worsen every year. As they will grow old, their skin will become more dry and dry. So they need to be extra cautious and very careful since very beginning. As I said that such skin type is prone to show the signs of aging earlier in their life, they are advised to use a good anti-aging formula as soon as they enter their 30s, and also a good under eye cream to prevent appearance of crow's feet around their eyes. Also, their diet should include fatty acids and water in good amount, and their moisturizer must include at least 2 types of moisturizing agents. Moisturizing agents are of different kinds to understand, like there are type of moisturizer which absorbs moisture from the surrounding. There are such moisturizing agents which holds moisture into the skin. There are types which make a protective seal over your skin surface and prevents evaporation of hydration from the skin to the outer environment, etc. So there are in total 4 to 5 kinds of moisturizing agent, and a good moisturizer for a dry skin individual must include at least 2 types of moisturizing agents. To name a few good brands, I would say at first place Aveeno from Johnson's & Johnson's is a very good moisturizer. Then comes Hyaluronic Lotion from Regalis, and there is one brand called Atogla, that is from Curatio. To mention good anti-aging preparations for dry skin individuals, we have like Sparderm from BDF Pharma and Averta from Dr. Reddy's. Also, Averta under eye cream for Dr. Reddy's is very good and very efficient to apply. Just to mention that if you are having dry skin condition and if you are selected a good moisturizing cream, then it will be sufficient to give a very good skin for long term. There will be no need to have extensive, lengthy and long skincare routines. A proper moisturizing agent will serve all the needed functions required to maintain a healthy skin even if you have dry skin. Also, just not a single application but at least 2 to 3 applications in a single day. Minimum 2 to 3 applications are required for dry skin individuals to get or to maintain their skin moisture level.
So thank you so much for watching our video. So please remember to like, comment and subscribe and hit the bell icon for further notifications, because we are going to be doing many more videos on skincare. So stay tuned.